Hello.
Good
Hi.
evening, ma'am.
Hi. Good evening. Can you hear me?
I can hear you fine. If we could have your camera on, please.
It is on. Can you see me?
I can see you now. Yeah. Thank you so
Oh,
much.
perfect. This is good, right?
Yeah, it's
You
perfect.
okay? Perfect. I might have to switch devices. Yeah, I might have to switch devices. Can I do that now?
Yeah,
Quickly.
sure, ma'am.
Okay. I'll just quickly do that. Sorry.
Hello,
Good evening, ma'am.
good evening. Can you hear me?
I can hear you just fine. Yeah. Thank you so much.
Yeah, okay, thank you.
Hello.
Good evening, ma'am.
Good evening, Sanika. Am I audible and am I visible clearly?
Yes, you are. Thank you so much.
Okay, thank you.
All right, great. Good evening, everyone. I hope you all are staying safe and keeping healthy. A warm and humble welcome to the webinar series by Sharp under Youth and Adolescent Health. My name is Sanika Gupta, and I will be moderating today's session along with my colleague Kanika Sachdeva. A brief introduction about Sharp NGO. Sharp stands for School Health Annual Report Program, working for over 22 years in the field of holistic development and healthcare of students and children. We at Sharp try to educate and open conversation on problems related to youth and adolescents. Through this webinar series, we hope to spark discussion on some very important topics pertaining to today's youth demographic. In this webinar, we aim to educate and create awareness about dissociative disorders in adolescents and mindfulness-based intervention techniques to help cope with such disorders. As we all know, and as we have discussed in previous Sharp webinars, adolescence is a very crucial and impressionable stage in everyone's life. Today's youth and adolescent population faces a large number of pressures from a variety of factors that makes them even more vulnerable. Today's conversation will be focused on dissociative disorders. Mindfulness is defined as a mental state achieved by focusing one's awareness on the present moment, thoughts, feelings, bodily sensations, etc. In today's webinar, we would also like to extend a special focus on mindfulness by exploring the ways in which mindfulness-based intervention techniques can help adolescents cope with dissociative disorders. We thank you all for being here today and joining us in this very important webinar. Before we start, I would like to thank all our panelists for taking the time to join us here today. On our panel today, we have Ms. Drishti Jaisingh, Ms. Swati Daruka, and Ms. Mohini Gupta. Ms. Drishti Jaisingh is a registered clinical psychologist with a BA Psychology from the University of Delhi and an MA in Applied Psychology from the Tata Institute of Social Sciences. She's worked with children, adolescents, adults, and the elderly across educational institutions, nonprofit organizations, and treatment facilities. She believes in an integrative approach, drawing from interpersonal learning theory and evidence-based practices such as cognitive behavior therapy, acceptance and commitment treatment, motivational interviewing, etc. Thank you so much for joining us here today, ma'am.
Thank you. Thank you so much for having me. I'm really looking forward to the discussion today.
Thank you. Next, we have Ms. Swati Daruka. She's a clinical psychologist associated with the Tata Health and Bajaj FinServe Health. They are online health platforms that provide predictive, preventative, and personalized healthcare to consumers. She has experience working with children, adolescents, and adults dealing with depression, anxiety, self-esteem, adjustment, and body image issues. A supporter of the client-centric approach, she believes in the power of the eclectic approach to psychotherapy. She's been awarded the best paper in the 8th International Conference of the Somatic Ink Block Association and inaugural conference of the International Telepsychology Association. It's an honor to have you with us here today, ma'am.
Thank you so much for the lovely introduction.
Thank you so much. Finally, on our panel, we have Ms. Mohini Gupta, a counseling psychologist with an experience of around 7 years. Currently, she's associated with the Manoyama Holistic Mental Health Center in Jaipur. She's been serving as a clinical psychologist for the past 2 years. She is known for her work with children, adolescents, adults, and parents. Her role as a clinical psychologist involves working in the areas of OCD, phobia, mental health, and behavioral issues. Her main therapeutic modalities are cognitive-based therapy, acceptance and commitment therapy, supportive therapy, art therapy, and mindfulness-based interventions. Thank you so much for being with us today, ma'am.
Thank you. Thank you so much.
Thank you. So we have a few instructions to the audience before we start the webinar. We will first have a round of discussion with our panelists, and then we will have a live Q&A round where we take up questions from the audience themselves. We request the audience to drop in their questions in the Q&A box, and we will be taking up live questions. The best live sharpest question of the day winner will get a gift voucher worth ₹500. Additionally, we request the audience not to fill in the chat box with unnecessary messages, as we may tend to miss out the important questions. So without further ado, we'd like to start today's conversation. I'd like to take one moment to again thank all the panelists for joining us here today, and thank every member of the audience for joining this discussion. So before we really get to discussing the details of today's topic, I think it's imperative that we first talk about what dissociative disorders really are, because given that knowledge about such issues may be limited, we'd like you to explain what dissociative disorders are to our audience in layman's terms, such that they understand exactly what the topic is that we're dealing with. So my first question to the panel would be, what exactly are dissociative disorders and what are the types? So Ms. Swati, if we could start with you, and then we'd move around the panel, because I'd love to hear from everyone.
Shanika, I think I didn't get it right. Are we waiting for responses from the audience first and then I start? Or am I supposed to start?
No, ma'am. We'd like to first just demystify the topic a little. So we'd like to hear from all of you as to what exactly dissociative disorders are.
Sure. Thank you for your question. So basically, this term dissociative disorders, as we can understand, this association in दो words से मिलकर बना है. So what happens in these disorders, we basically disassociate from some aspect of ourselves or our feelings, emotions, our body, some aspect. More than one aspect or modality may be associated with it, or it can just be limited to one of it, right? So, और हमेशा एक और चीज है, I hope everyone understands Hindi as well. So I'll do a mix of both the languages. So basically what happens is, it's not necessary कि हमेशा diagnosable होगा. It does not mean that only somebody who is mentally unstable in some aspect or has mental health disorder will have disassociation or dissociative disorder. It can happen with me, with you, with any of us. But what is important is the extent of it, I'm sure all of us might be daydreaming sometime or the other, कभी exams से पहले लगता है कि I wish the exam gets cancelled, and then you get lost in your thoughts कि something happened, the exam got cancelled, I got time to study, etc., etc. So that is also a form of dissociation. And we cannot really say that it is unhealthy if it is not hampering your life in any manner, or if it happens for a short amount of time and not to a great intensity. So all of us engage in some form of dissociation, A lot of times you might have even heard your friends or family, or you would have realized when something terrible happens to you or your family. कई बार कहते हैं ना कि मुझे feel ही नहीं हो रहा था. I was in another zone. I could not realize that something like this is happening to me. It seemed like I'm just listening about it. It wasn't sinking in. So all of it is a form of dissociation, right? अब ये unhealthy कब बनता है? Actually में it's a way of coping. All of us have different ways of coping with the situation. So कभी हम म्यूजिक सुन के कोप करते हैं, कभी जो प्रॉब्लम है उसके साथ डील करके कोप करते हैं, कभी we talk to our friends, with our family, and there are a lot of other ways to deal with the situation. But when we kind of dissociate from one aspect of ourselves, from our mind, from our body, then dissociation occurs. So till a certain limit, it may be healthy, but after a point, it becomes unhealthy, you know. Once it starts impacting your daily life or the life of those around you. I would just like to share a story. Sanika, please tell me if I have the time, otherwise I'll just cut it short.
Absolutely, ma'am. Please go ahead.
Sure, thank you. So, because we are dealing with adolescents mostly, and our listeners are mainly adolescents and teachers, so I think this will be quite relevant, and I'm sure आप लोग भी कभी ना कभी in these long years might have come across some situation of this sort. So, you know, back when I was in school, I went to a boarding school, right? And boarding schools में क्या होता है? You don't have too much communication with the outside world. You stay with your teachers and you stay with a limited number of students, and that is your world in a way, right? So if let's say there's a problem that occurs, तो आप बाहरी help नहीं ले सकते हैं. You are in that situation mainly, you know. So what happened? We had our board exams going on, and there was a student who would suddenly faint, you know, and she would faint very often. In one day, she would faint 3 times, 4 times, and you know, it was so serious. She is just standing and talking to somebody, suddenly she'll fall down, you know, and of course, because board exams were happening, and you never know आजकल इतने सारे illnesses हो गए हैं. So all of us, you know, her parents, the school authorities, her friends, everybody got really upset and concerned. So she went for a thorough medical examination. She got all her tests done. Everything came out to be normal. So इससे क्या है, लोगों में और ज्यादा डर हो गया कि, you know, detect भी नहीं हो पा रहा है. So how do we deal with it? Now, unfortunately, the reality is that not many of us are aware about, you know, mental health or disorders associated with these issues. So, you know, unfortunately, the doctors also did not realize कि इस वजह से हो रहा है. But क्योंकि बोर्ड एग्जाम से सबने सोचा कि या तो कुछ बहुत सीरियस है या शायद बोर्ड की वजह से हो रहा है. And you know, after a while, also she had some interpersonal problems happening at the same time. So 2-3 महीने ऐसे ही निकल गए, and she would keep fainting and not doing well. But one thing that was very surprising was that she never hurt herself. कभी भी उसको चोट नहीं लगी, despite having fallen to the ground so many times, you know. A lot of times ऐसा situation था. We had those large steel trunks, you know, with pointed edges. So sometimes she would fall very close to it but never hurt herself. तो हम सोचते थे कि, you know, thank God बच गई, वरना बहुत जोर की चोट लग जाती. So that is one of the very important signs that you can notice. कि जिन लोगों को डिसोसिएटिव डिसऑर्डर्स होते हैं, उनको कभी चोट नहीं लगेगी. और मान लीजिए कभी लगती भी है, it will be very, very minor. It will never be anything serious or major. So anyway, after that, everything got over, both got over, her interpersonal issues got sorted out, and she went out of that environment and she recovered. उसके बाद उसको नहीं हुआ. Now, luckily in this case, the situation that was causing stress was taken away and she was fine. But in a lot of cases, with a lot of people, ऐसा होता है कि आप उस सिचुएशन से बाहर नहीं निकल सकते हैं. So then that keeps happening for a very, very long time. And you know, in similar situations, some such incidents might happen, such situations might happen. And also, जरूरी नहीं है कि हर बार symptoms same हो. Sometimes it can be fainting. Sometimes it can be, you know, something like paralytic attack. Sometimes it can be something like epilepsy. It can be just literally anything you can imagine. Sometimes association की वजह से blindness हो जाता है, या आप उठ नहीं पाओगे. Like whatever you can imagine, whatever is bodily possible, any of it can happen. So you know that is mainly dissociation. Just breaking the connection from your mind or body and kind of compartmentalizing or not being associated with the present moment, in short.
Got it, ma'am.
And
Thank you so
we'll
much.
have this, yeah, thank you. We'll have this discussion, and I'm sure we can clear more doubts and have a discussion that will bring more clarity and light on the situation.
Absolutely. Thank you so much for that, ma'am. And thank you for giving such a range of examples, because I'm sure that will help people understand that in more detail. So thank you so much for that.
Thank you, Kanika.
Thank you. Ms. Drishi, if we could hear from you.
Right. Firstly, I'd like to thank Swati for that amazing description. I love how you shared that example of that teenage girl. And I think we've all over the years have seen that maybe dissociation is a way for us to express our symptoms, right? Now that you've said teenagers, and sometimes we might lack the vocabulary to share what we're going through or our symptoms. And kahin na kahin, dissociation then becomes that medium for us to share or for us to have that experience without having the right words for it. Kahin na kahin, I also understand dissociation as a split. It's the lack of continuity in between the experience that I have and the experience that dissociation creates for me. That's how I have understood it. And I think once we go through the types of dissociation, we will be able to describe that better. You can use Hindi and English both. Sure. I think I'm also comfortable with both Hindi and English. So if anybody does not understand, please ask us, and I think we'll be more than happy to share what we were saying. But coming back to dissociation, I think coping is nothing but jab tumhari body is unable to, when your mind is not able to deal with the stressors, with the trauma around you, with a stressful situation, that's when हम ऐसे coping strategies use करना शुरू होते हैं. Sometimes one of the most important coping strategies that most of us use day-to-day basis में is distraction. कुछ बहुत स्ट्रेसफुल या बहुत ओवरवेलमिंग हो रहा है एग्जाम से पहले, फॉर एग्जांपल मैं टीवी देखना शुरू कर दूंगी. Yeah, some people have also, the cases are increasing with respect to stress eating or binge eating. So binge eating, binge watching, these are some things that are happening very frequently aajkal ke adolescents mein. And I think dissociation is one of those things that your mind helps you create a separate reality, a separate world, jahan pe sirf tum ho, and you can have more control over the situation. I think dissociation is also a way for you to control your world. And I think jaise Swati ne abhi mention kiya that it's so controlled that even if there is a fall or even if there is an injury, you're not hurting yourself. तुम्हें चोट नहीं लग रही है, right? So it's a very interesting space. And I think it was in the late 18th in the 18th century when dissociation and multiple personality disorder, I think that's one thing that सबने कहीं ना कहीं सुना है इसके बारे में. अगर ज्यादा पता नहीं है तो सबको पता है कि multiple personality एक चीज है, which is again one of the type of dissociations. That's when a lot of I think a lot of attention was focused on dissociative disorders. I think this is also one field of psychology that requires a lot of research. बहुत अभी we need to explore it further. अभी जितना भी हम इसके बारे में जानते हैं is still the tip of the iceberg. As Freud would say, there is still a lot more for us to learn from and about dissociation. But yes, that's how I understand it, being the disconnect between the continuity of our reality, जो हम experience कर रहे हैं, हमारा behavior, and like Swati rightly mentioned, right? Even something जैसे blanking out या zoning out in a normal conversation is a form of dissociation. If I can quickly go over the forms of dissociation, I think one is detachment, which is depersonalizing and derealization. So where we're not in touch with our personalities and our realities around us. So that's one form of dissociation. The other is absorption, where you're so absorbed in your own thoughts. जैसे overthinking अगर हम करते हैं, we're so absorbed in our own thoughts कि we're blanking out or we're zoning out, we're daydreaming, sitting in one place. And then there's also something called compartmentalization, which is somewhere where we can see body symptoms like headaches, migraines, falling or fainting episodes, even memory losses. You don't remember कि उस time period में तुम्हारे साथ क्या हुआ था, क्या नहीं हुआ था, which is amnesia. So there are different types of dissociations. We can talk about those, but these are the common strategies that dissociation sees. That's from my end.
Thank you so much, ma'am. Thank you for that. Another perspective on the same topic, like another way of phrasing it, and of course, talking about the ways that it can manifest. I think that's very important for our audience to know as well. So thank you so much. Ms. Mohini, if we could hear from you as well. And if you could also just briefly touch upon the types of dissociation as well.
Yeah, sure. I agree with Swati and सृष्टि की डिसोसिएशन बेसिकली जैसा कि उन्होंने बोला कि दैट इज अ एरिया जो कि बहुत इंपॉर्टेंट है जिस पे वर्क करने की जरूरत है, क्योंकि अभी ये यंग एंड एडोलसेंट में बहुत ज्यादा कॉमनली देखा जा रहा है, जहाँ पे स्ट्रेस आते ही दे डिस्कनेक्ट विद सेल्फ, might be mental level, might be feeling level, might be emotional. So yeah, so this is a dissociative disorder, and if we talk about the dissociation forms, so there are many type of forms जो कि जनरली हम पेशेंट्स में देखते हैं, स्पेशली एडोलसेंट में, कि अमेजिया हो जाना कि कुछ सेकंड के लिए या कुछ पर्टिकुलर मूवमेंट के लिए दे फॉरगेट कि वो क्या कर रहे थे, क्या हो रहा था. इवन व्हेन आई सॉ द पेशेंट्स, तो कई फीमेल्स आते हैं, वो अपने घर से निकल जाते हैं, बस पकड़ के कहीं चले जाते हैं, एंड दे फॉरगॉट कि वो क्यों कर रहे थे, ऐसा क्यों हो रहा था, राइट. एंड ऐसा नहीं होता है कि उस जर्नी में उनको कुछ हर्ट होता है या कुछ प्रॉब्लम क्रिएट होती है. दे आर वेरी सेफ टुडे बट फॉरगॉट फॉर सम टाइम. सो ऐसा होता है. देन इसमें ब्लाइंडनेस भी होता है. एक मेरी पेशेंट थी विच इज कंप्लीटली म्यूटिज्म की, उसको वो बोल नहीं पा रही थी. शी जस्ट स्पीक इन अ ब्रीथ, वो ब्रीथ में बात कर रही थी लेकिन आवाज नहीं आ रहा था. तो दिस इज ऑल्सो अनदर फॉर्म जो कि कॉमनली होता है बट डायग्नोस नहीं होता है बेसिकली. सो आई थिंक दिस इज अ मेजर और कॉमन जहाँ पे और ये एडोलसेंट और यंग चिल्ड्रन से बहुत ज्यादा हो रहा है. फेंट हो जाना इज अ वेरी कॉमन फॉर्म ऑफ डिसोसिएशन जो कि डायग्नोजेबल नहीं है. एंड पेरेंट्स आर जस्ट टेकिंग कि भाई क्यों हो रहा है, शायद वीकनेस की वजह से हो रहा होगा, बट दैट इज अ मेन कॉज ऑफ स्ट्रेस जहाँ पे वो कोप नहीं कर पा रहे हैं, या फिर द वन वे टू कोप द स्ट्रेस विच इज नॉट हेल्दी.
Got it, ma'am.
That's it.
Thank you so much. I
Thank
think
you.
सबसे जो मुझे समझ में आया है कि डायग्नोज करना बहुत ही मुश्किल है, because I feel कहीं ना कहीं it's getting probably mistaken for other forms of illnesses. So before we kind of go into the diagnosing side, I wanted to understand what are the causes of such disorders. Why would a child develop a dissociative disorder? Ms. Drishti, if we could hear from you.
Right. I think, like we were just talking about, I think stress, any form of stress that we are not able to cope up with, is a major reason why people tend to dissociate. जब हमारे सामने की सिचुएशन इतनी बड़ी हो जाती है और हमें लगता है कि हमारे पास इतने रिसोर्सेज नहीं है उसको फाइट करने के लिए, I think that's one of the most common spaces where somebody dissociates. Trauma is another reason. I think there's a lot of research in terms of sexual trauma, physical trauma, emotional trauma that people might have experienced, any form of violence. It could be a traumatic life event. I think somewhere there's also languishing that has come up these days, which is a feeling of blandness. I think that is also a form of dissociating from the reality. And this is something that most of us are feeling post the pandemic. This is still my theory. I'm still doing research on it. There is no evidence-based research yet. But I personally feel that dissociating from reality is something that happened for most of us during the pandemic. हमें नहीं समझ आ रहा था कि what is the world. There was so much anxiety. So any form of traumatic event, personal or on a societal level, would be one of the major reasons for dissociation. This is all I can think of right now, and I'm sure there is a lot of research. Maybe the others can also correct me or add wherever is correct. But जितना मुझे समझ आता है, I think stress and trauma and inability to deal with it is a major cause of dissociation.
Absolutely. Thank you, ma'am. And thank you for tying it back to the pandemic because that's a recent event that everyone has faced. So it becomes easier to form that sort of correlation. Would any of our other panelists like to add anything onto this question?
Uh, Drishti has very correctly given the two major reasons that we actually start dissociating. In addition, a lot of times children or people in general, everybody likes different levels of attention. So whenever something like this happens, जब आपको dissociative symptoms होते हैं, let's say fainting या जैसे मोहिनी जी बता रही थी कि आवाज नहीं निकल रही थी, there was mutism or anything in general, what do we see around us? The parents, the family members, teachers, everybody starts giving a lot of attention to that individual. कई बार वो फेवर करने लगते हैं, दे टेल दी अदर चिल्ड्रन कि इससे लड़ो मत, इसको कुछ बोलो मत, इसकी तबीयत ठीक नहीं है. So these things also kind of reinforce this dissociation, और naturally अगर कोई चीज आपको फायदा दे रही है तो आप तो वो चीज बार बार करोगे. So that is what happens, and this starts rising for those people. इसके अलावा there's one more thing that we've noticed, like there's literature also, और हम अपने clients या patients में भी देखते हैं. Lot of you would have noticed कि जैसे parents के या family members का behavior होता है, same comes down in children, because we adapt a lot of strategies by learning and seeing those around us. तो कुछ लोगों के घर में ये trend होता है कि कोई एक पर्सन बीमार हो जाता है. Let's say there's a joint family, right? So everybody is supposed to work, but there is one person who gets sick very often. तो उसे क्या करना होता है, काम से भी छुट्टी मिल जाती है. Secondly, that person gets a lot of attention also. So the children around also start learning the same behavior. And that is another very major cause of dissociation. Of course, I'm not saying that everybody will start doing this, but it is one of the major factors that counts.
Thank you so much, ma'am. I think what a simple example था, seeing someone in your family fall sick, but to know that it can manifest in such a major way, probably later in adolescence, is actually, it's very eye-opening. So thank you so much for that.
Thank you.
I want to also ask from the perspective of an external stakeholder in a child's life, be it a teacher or a parent or a sibling or a friend, what are some sort of red flags to look out for, in the sense that, agar ye ho raha hai, then it's possible that my child is facing a dissociative issue, or, this is a sign that they maybe need help. So what are some of those red flags or indicators that parents or teachers can look out for? So ma'am, Swati ma'am, if we can start with you.
Sure, thank you for the question. So like I was telling in the first story or example that I gave, बहुत सारे tests हो गए थे, medical tests, everything came out to be normal, right? So that is one very major indicator. Dissociation will seem to be just like any other illness that you might have. पर किसी भी मेडिकल टेस्ट में आपको कुछ भी नहीं नजर आएगा, your brain MRI will be normal, आपके बॉडी में जहां पर भी प्रॉब्लम हुई है, whatever it is, all of it will be normal. That is the first major indicator, and we usually get to know also now, because if a child is fainting or something happens, सबसे पहले डॉक्टर के पास ले जाते हैं. So that is the first major indicator. दूसरी चीज आप नोटिस कर सकते हैं कि whenever the person, the individual is getting more attention, उन situations में ये behavior ज्यादा होगा. जहाँ attention कम मिल रही है वहां पर ये behavior कम होगा. Let's say there's a test schedule and there is one person who has something like this, वो test नहीं देना चाहता है, and if the teacher excuses that individual, so what will happen? It will keep happening every time something like this comes up, Anytime a situation where you cannot handle the stress, something like this will come up. On the other hand, लेट्स से there's a teacher जो आपको टेस्ट से एक्सक्यूज नहीं करते हैं एंड दे विल टेल यू कि जितना जैसे भी टेस्ट देना है दो एंड योर मार्क्स विल बी काउंटेड. यू विल नोटिस दैट उन टीचर्स के सब्जेक्ट में ऐसा बिहेवियर नहीं होगा. You know, right before their exam is scheduled, it will not happen. So these are two major indicators.
Absolutely, ma'am. Thank you so much for that, and thank you for explaining with that simple example. Would any of our other panelists want to add on to this?
One quick small thing also, ki, you know, when you notice people are not able to express themselves, I think that's also when you know that this child or this adolescent is at risk of dissociating. So you know that somebody who does have a good relationship with their parents or does have a good relationship with their peers or teachers or mentors, whatever, those people have a channel of coping and sharing what they're going through, right? जिन लोगों के पास ये साधन नहीं है या ये connection नहीं है, I think they would struggle more and are again at more risk. So that might be a red flag. How much is the child expressing? How much is the child sharing? So it would be nice to maybe bridge that gap if feasible, so that we can avoid कि ये dissociation possible है. I also think that in India it's very common कि हमारे जो भी stress related symptoms हैं वो हमारी body में noticeable होते हैं. Like Swati rightly mentioned कि medical explanation नहीं होता है इन symptoms का, but you can even something like PCOS has a lot of evidence, or PCOD, whatever whoever's calling it, or migraine, they do have some mind body relationship, and stress is a major trigger there, right? So if you are noticing that there are multiple conditions which are stress related, I think it will be good to take back to where the stress is coming from, and is the child dissociating or not dissociating as much. So that might also be a red flag for us to notice कि उनकी coping skills क्या हैं और वो कितना use कर पा रहे हैं अपने आप से, they're able to manage things.
Thank you so much for adding on, ma'am. So my next question is, so we know that obviously seeking out professional help is very important in such cases, but healing obviously continues outside of the therapy session. So what is the attitude that these stakeholders should take towards children or adolescents with dissociative disorders? How are we supposed to treat them? Or, you know, like we've talked about the attention thing, that they seek extra attention. How are parents and teachers supposed to deal with that on a day-to-day scenario? Ms. Mohini, if we could hear from you.
Sure. Thank you for this question. This is very important कि parents या teacher deal कैसे करे dissociation के साथ, क्योंकि firstly तो उनको recognize होना बहुत important है कि this is a dissociation. अदरवाइज क्या होता है कि जैसा स्वाति ने दृष्टि बताया कि अटेंशन गेन करने की वजह से वो बहुत लॉन्गर ड्यूरेशन तक कैरी होता रहता है. सो कैसे डील करना है, तो जैसा अटेंशन फर्स्टली जो हम एडवाइस करते हैं पेरेंट्स को, फर्स्ट ऑफ ऑल कि अटेंशन जब भी ये डिसोशिएट सिम्टम्स हो रहे हैं, लाइक अगर वो फेंट हो रहे हैं या फिर कोई फिट्स आ रहा है, क्योंकि डिसोशिएशन में फिट्स भी आते हैं जो कि एपिलेप्सी जैसे लगते हैं बट दे आर सूडो फिट्स. तो वहां पे उनको अटेंशन उस समय पे पर्टिकुलर दैट मोमेंट पे उनको अटेंशन नहीं देना है, बहुत ज्यादा केयर नहीं करनी है, बहुत ज्यादा उसमें पे पैम्पर नहीं करना है. क्योंकि जनरली क्या होता है, जैसे कि स्वाति ने भी बताया कि फेंट हो रहे हैं तो दे स्टार्ट की बहुत ज्यादा केयर करना स्टार्ट कर देंगे, घर से बाहर निकलना नहीं, बेड पे ही सब कुछ देना, बेटा ज्यादा स्ट्रेस मत लो, पढ़ाई मत करो. तो ये चीजें स्टार्ट हो जाती है, ठीक है. तो वो डिपेंडेंसी वाली चीज भी आ जाती है, तो वो एक्स्ट्रा जो अटेंशन देना है वो नहीं करना है. और दूसरी चीज की जो भी उनका स्ट्रेसर है उसके लिए फर्स्टली जो साइकोलॉजिस्ट होते हैं, जो क्लिनिकल साइकोलॉजिस्ट होते हैं, उनके पास लेके आना है. क्योंकि अगर पेरेंट्स या जनरली कई बार ये भी देखा गया है कि हम उनको ये बोलते हैं कि अटेंशन की वजह से कर रहे हैं या फिर प्रॉब्लम की वजह से हो रहा है, तो कई बार पेरेंट्स इस तरीके से भी बोलना स्टार्ट कर देते हैं कि तुम नाटक कर रहे हो, ठीक है, कोई तुम्हें परेशानी नहीं है, जस्ट तुम नाटक कर रहे हो. तो इस तरह के क्रिटिसाइजिंग या इस तरह के वर्ड्स भी यूज नहीं करने चाहिए पेरेंट्स को. एंड डीलिंग करने के लिए बेस्ट यही है कि सेकंड ऑप्शन कि उनको फिर साइकोलॉजिस्ट के पास लेके जाए, सो दैट कि वो उनको जो स्ट्रेस हो रहा है, जिस वजह से वो डिसोशिएट हो रहा है, उसको डील करना सिखा सके कि भाई कैसे आपको स्ट्रेस को डील करना है बजाय डिसोशिएट होने के। तो मेन तो ये चीज है जो कि हम पेरेंट्स को एडवाइस देते हैं।
थैंक यू सो मच मैम। आई थिंक वो एकदम इट पॉइंट्स टू दैट हमें मिडिल पाथ लेना चाहिए, ज्यादा अटेंशन भी नहीं देना चाहिए, बट ऑन द क्रिटिसाइजिंग साइड वो भी ज्यादा नहीं करना चाहिए।
Yes, yes.
So thank you so much for that. But I would also want to ask from the perspective of peers and friends of some adolescent that is going through such disorders, what is the stance they can take?
Yeah, definitely. For the peers and the friends also, फर्स्ट ऑफ ऑल कि उनको ये समझना होगा, ये अंडरस्टैंड करना होगा कि जो ये प्रॉब्लम जनरेट हो रही है वो किस वजह से हो रही है, राइट। और वहां पे भी अगर पेरेंट्स हैं या पीयर्स हैं, अगर वो भी अटेंशन दे रहे हैं, कई बार ऐसा होता है कि इवन फ्रेंड्स भी अपने फ्रेंड्स का अटेंशन पाने के लिए या फिर रिलेशनशिप इश्यूज आते हैं, वहां पे अगर वो लोग बात नहीं कर रहे हैं तो उस पार्टनर को वापस अपनी लाइफ में लाने के लिए भी दे स्टार्ट डूइंग इट। सो सो वहां पे वो फैक्टर, वो पीयर्स और फ्रेंड्स को भी वो चीज वहां पे अंडरस्टैंड करके उसको बस मिनिमाइज करना होगा, बजाय उसको रिजेक्ट करने के या अवॉइड करने के, उसमें साइड देके काम करने से आई थिंक वो डील अच्छे से हो पाता है।
Thank you so much, ma'am.
Yeah.
So I think now we've established sort of a nice base of what exactly disorders are. I'd like to move on to the second part of today's topic, which is about mindfulness-based intervention techniques. So I'd like to start with what exactly are mindfulness techniques in from a psychological perspective, and how exactly they can help deal with such disorders, physical and mental disorders. So Ms. Drishti, if we could start with you.
राइट, सो माइंडफुलनेस, हम में से कितने लोगों को पता है कि माइंडफुलनेस क्या है, राइट? आई मीन फ्रॉम द वर्ड इटसेल्फ, what it says is you're being mindful, you're being aware of what your actions are, of where you are in this time and space dimension, kahan tum बैठे हो, what are the sensations in your body. If everybody is sitting right now, you can feel the chair or the sofa or the bed that you're sitting on. That is being mindfully aware कि हम कहाँ हैं, क्या कर रहे हैं, क्या बातें सुन रहे हैं, कौन सी sensations हो रहे हैं हमारे around. So I'm assuming since everybody is listening to us right now, they can do that. If they're seeing us right now, that is another form of being mindful of where you are at. So in simple words, that is how I understand mindfulness. As for a strategy or how to be mindful, when we talk about this, there was an amazing person who introduced mindfulness. I mean, it's a relatively common concept, सबको पता है कि meditation क्या होता है, but mindfulness was described by I think Kabat-Zinn, if I'm not wrong, where he linked it to Buddhism, and he spoke about how mindfulness is not being an autopilot mode, जो हमें पता है कि हमारा सुबह से क्या रूटीन है या हमारा दिनचर्या क्या है, कि सुबह उठेंगे, ब्रश करना है, नहाना धोना है, तैयार होना है, स्कूल जाना है या काम पे जाना है, बीच में लंच खाना है, हमें पता है कि लंच में क्या है, कैसे खाना है, चावल है तो हम हाथ से खाते हैं या स्पून से खाते हैं, रोटी है तो उसको तोड़ के खानी है. None of us are very mindful of what is happening. हम वही सेम रूटीन में ऑटो पायलट करते जाते हैं. It's very mechanical in that sense, right? And what is mindfulness is being aware of the situation you're in the here and now. You're present in the here and now, and somewhere a mindfulness habit, or it's a way of life. It's not just a technique. ऐसा नहीं है कि हम किसी को सिखा देते हैं कि ये mindfulness है और तुम करना शुरू कर दो. I mean, obviously there are techniques to be mindful, but मेरा understanding है कि mindfulness is a routine that we have to adopt. It's like we have to all become mindful individuals so that we don't have these problems. That's how I understand mindfulness. As for the formal definition, it is being aware and being non-judgmental, being able to observe and accept the reality, the situation around us, and be able to let go of things and not hold on to things. जब हम overthink करते हैं, we fall into a overthinking loop or a bracket, right? Mindfulness is for us to be aware कि हम overthink कर रहे हैं. We're not saying mindfulness will help you not overthink. It will help you bridge that gap between overthinking and being present in that reality. So mindfulness is nothing but a tactic or a strategy that will help me ground myself to the present reality. If I'm somebody who gets angry very quickly, am I able to be mindful of what my triggers are? ऐसा मेरी मम्मी ने क्या बोला मुझे कि मुझे गुस्सा आ गया कि मैंने स्कूल में भी जाके किसी से लड़ाई कर ली, या मैंने अपने पार्टनर से भी लड़ाई कर ली, राइट? सो माइंडफुलनेस इज दैट 10 सेकेंड गैप कि knowing where I am at, मैं कैसा रिएक्ट कर रही हूँ, and can I change my behavior and do something else differently? Do I have an alternative option in that sense, right? And again, once I'm able to build that awareness, I will be able to control the situation better. Like I said, that for people who get angry या people जिनको बहुत short tempered होते हैं, right? हम immediately react करते हैं. We are so impulsive कि किसी ने कुछ बोला मैंने वापस चिल्ला दिया, right? Mindfulness is I am able to create that window of impulsiveness to 5 seconds or 10 seconds, and I'm able to control कि ठीक है उसने मुझे कुछ बोला but मैंने उस वे से react नहीं किया. So that was probably a mindful reaction or a mindful stance to how things could have been. And like we're talking about, mindfulness is not just limited to dissociation, but I think it's a skill that most of us can take back. A small exercise would be, I think this is all over the social media right now, but a 5, 4, 3, 2, 1, right? So grounding our senses to where we are is a simple mindful activity. When you are, and this is something that मैं अपने clients को refer करती हूँ, maybe all 140 of us after today's session can probably try doing this. Maybe the next time you are washing your hands right before eating food or after, why don't you be mindfully aware of आप अपने हाथ कैसे धोते हो? क्या आप पहले पानी से उसको गीला करते हो, उसके बाद आप साबुन लगाते हो? Do you put साबुन at the back of your hand या सिर्फ ऐसे धो के खत्म कर देते हो? Or how long do you spend in that activity? Do you like to wash your hands with cold water or warm water? So maybe after today, or maybe just for today, we can all be a little more mindful while washing our hands. And as therapists, I think हमारा goal यही होता है कि once we're able to bring that awareness of what mindfulness is, and maybe teach a couple of techniques, we're able to generalize that process into using it as a skill, as a coping skill. I think what we were talking about, dissociation, maybe it is one of the skills. Is it a healthy skill? Sometimes. Is it an unhealthy skill? Sometimes as well, right? But mindfulness is a skill that in 90% of the cases is a more healthy coping mechanism. That's my take on mindfulness. And do you want me to go ahead with the dissociation bit, or can we hear from everybody else on mindfulness as well?
All right, yeah. So I'd like to just hear a little bit about the basis of mindfulness from everyone and then discuss it in relation to dissociative disorders as well in greater detail. But I'd like to thank you so much for that explanation. I think something that really caught me was that mindfulness is not to stop you from overthinking, but to realize that you are overthinking. I think that beautifully captures the essence of what mindfulness is. So thank you so much for that. Would anyone else in our panel also like to add to this?
Ms. Rishi has beautifully explained what mindfulness is and how we can go ahead with it. And, like she mentioned the term autopilot. So I think most of us would agree that these days, of course, our gadgets have a big role to play because we are so engrossed in our gadgets all the time. Our life has become so busy that we don't even look around, A lot of times I just ask my clients, वो रोज एक particular route से office से घर जाते हैं या घर से office जाते हैं. So, in fact, we can all do it with our own selves. आप बस पूछ लीजिए, कि while going from your house to your office, how much time does it take? वो बता देंगे कितना time लगता है, because they leave the house at that minute. But if you ask, you see any guava trees on the way, nahi bata payenge. And it's not just about science, it's about most of us, I think. if you just ask them कोई particular shop का नाम कि आपने ये shop देखा है क्या, वो नहीं बता पाएंगे. Although, if you actually go to the location, you will realize that I pass by this shop every day. And our lives have become like that a lot of times. I think most of us might be using social media or at the end of the day, yeah, sometimes when we are very free, so automatically we find ourselves reaching for our phone and opening Instagram or Facebook or, some other social media site. हम क्या करते हैं, हम scroll करते जाते हैं, we like a few posts and we just keep scrolling. And sometimes if I just ask you, or if you just ask yourself कि अभी आपने किनका post देखा and what all did you like, हम नहीं बता पाएंगे, although it happens just a few seconds or a few minutes back. So these are all examples of not being mindful or being not mindful. So again, like Drishti beautifully mentioned, we must all start being mindful. I would not say, or I think none of us would say कि आप पूरे दिन mindful रह के start करिए, because that would just be too much extra work for everyone. Just start with 5 or 10 minutes, and then you will start noticing the difference. धीरे धीरे करके वो 5-10 minutes will become 1 hour, 2 hours, 3 hours, and then it will become a generalized thing. So that is something very important. Now, another thing is acceptance. Then we talk about being mindful, and Drishti also mentioned the term non-judgmental. So most of the times क्या होता है, कई बार आप देखेंगे ना, especially those of us who live in cities like Delhi, Mumbai or any other major city, usually morning hours में बहुत ज़्यादा traffic होता है. And a lot of times if we take a cab or आप notice करेंगे, there are some people who are driving, they'll start abusing, or if there's a jam, they'll start getting very panicky or angry, anxious. तो इससे क्या होगा, अब आप एक situation में stuck हैं, traffic jam लगा है, you can't get away from it, right? So what can you do about it? ऐसा तो नहीं है कि आप अगर कोई गाली देंगे, आप गुस्सा करेंगे तो आपके लिए रोड खाली हो जाएगा, right? So in such a situation, a lot of us tend to get angry, and that does not help us at all. Here, if we just accept the situation, कि हाँ, there's a traffic jam, ठीक है? I am not saying कि आपको खुशी मनानी है कि traffic jam है, आज तो मैं late हो जाऊंगा. But if you just accept कि ठीक है, traffic jam है, there is nothing I can do about it. तो आपका थोड़ा सा गुस्सा कम होगा, जो BP probably rise हो गया है वो लिमिट में जाएगा, and then you can figure out कि मैं क्या कर सकता हूँ. Sometimes there's a different route that you could take probably, or you could just make a call to your supervisor at work, or whatever steps can be taken, you can take. So the trick is just to accept what is happening and be objective about it, and then probably you can figure out what to do next. So that way, at least this anger or खराब mood या गुस्सा या आपके पूरे दिन में ट्रांसफर नहीं होगा ना. And if something happens to us, आप कई बार देखते हैं, a lot of you are students, a lot of you might be teachers, कि किसी दिन प्रिंसिपल या टीचर का मूड खराब है तो काफी स्टूडेंट्स का मूड खराब हो जाता है. किसी दिन बॉस का मूड खराब है, सबका मूड खराब होता है. What's the point? It also helps us to realize what impact my actions have on those I interact with. So, once we start doing these things become a lot easier for all of us, right? So just accepting what is happening again is very helpful and adds a lot to our lives and those around us.
Absolutely, ma'am. Thank you so much for adding that lens of acceptance as well. And I think the examples that both you and Ms. Drishti gave about, just simply becoming more mindful about washing your hands, or the route that you take to office or to school, those are simple things that you can do to develop mindfulness. So thank you so much for sharing those. Now I'd like to move to Mohini, ma'am, and just ask about what are some of the mindfulness-based intervention techniques that can be relevant to deal with dissociative disorders.
Yeah, basically, जैसा स्वाति और दृष्टि ने बताया कि माइंडफुलनेस इज इट्स आई थिंक इन माय ओपिनियन इट्स अ स्टेट, माइंड ऑफ स्टेट, जहाँ पे आप प्रेजेंट मोमेंट के साथ अवेयर हो रहे हो विदाउट एनी जजमेंटल, कि ऐसा क्यों हुआ, उन्होंने ऐसा क्यों बोला, इट हैपन. सो बेसिकली द नेक्स्ट टर्म इज कमिंग acceptance. So if we talk about the mindfulness, how it's deal with in disorder, कि कैसे वो डिसोसिएशन या स्ट्रेस है या एंजाइटी है, कैसे वहां पे ये हेल्प कर सकता है. तो आजकल अगर हम डे टू डे लाइफ की बात करें तो देयर आर लॉट ऑफ स्ट्रेस, एंड जहाँ पे आप बहुत ज्यादा उसको चेंज नहीं कर सकते कि भाई सिचुएशन चेंज हो जाए. सो बेसिकली देयर आर लॉट ऑफ सिचुएशन. इफ वी टॉक अबाउट द फाइनेंशियल सिचुएशन या कोविड की अगर हम बात करें, तो कोविड में बहुत लोगों को मेंटली और साइकोलॉजिकल इश्यूज हुए हैं. सो वहां पे माइंडफुलनेस कैसे वर्क कर सकता है, या डिसोसिएशन भी हुआ है, तो एक्सेप्टेंस करना कि भाई क्या चल रहा है, उन सिचुएशन में हमारे माइंड में क्या थॉट आ रहे हैं, बाय द ऑब्जर्विंग द थॉट, बाय द ऑब्जर्विंग द इमोशंस, सो दैट जस्ट अवेयर कि क्या हम सोच रहे हैं, क्या हम फील कर रहे हैं, विच इज कैन नॉट चेंज, जिसको आप चेंज नहीं कर सकते हो. सो आप चेंज नहीं कर सकते, आप एक्सेप्ट करोगे. सो नाउ यू हैव अ ऑप्शन कि नाउ ये जो प्रॉब्लम है, अब इसका हम सोल्यूशन क्या निकाल सकते हैं. सो आपका जो फोकस है, आपका जो अटेंशन है, वो इंक्रीज हो जाता है टुवर्ड्स द सोल्यूशन, जो कि आपको फिर मेंटली या साइकोलॉजिकली इफेक्ट नहीं करता है. सो इफ वी कम अबाउट द डिसोसिएशन, सो जैसा कि स्ट्रेस की एक कॉज बताया कि स्ट्रेस की वजह से डिसोशिएट होते हैं. इट माइट बी फाइनेंशियल कॉज की वजह से स्ट्रेस हो रहा हो, इट माइट बी रिलेशनशिप की वजह से स्ट्रेस हो रहा हो, इट माइट बी फैमिली इश्यूज है उसकी वजह से स्ट्रेस हो रहा हो, एंड द पर्सन इज डिसोशिएट. तो जस्ट माइंडफुल दैट मोमेंट, द सिचुएशन, कि भाई क्या फैमिली में हो रहा है, क्या चल रहा है, जो कि आप चेंज नहीं कर सकते, बट उस सिचुएशन में रह के आपके पास क्या ऑप्शन है जिससे कि आपको स्ट्रेस ना हो. सो उसमें हमारी जो माइंडफुलनेस टेक्निक होती है, बेसिकली हम वहां पे जैसे कि जस्ट ने बताया था, बहुत कॉमनली हम यूज करते हैं ग्राउंडिंग टेक्निक, जिससे कि हम अपने प्रेजेंट के साथ, अपने 5 सेंसेस के साथ और प्रेजेंट के साथ कनेक्ट होते हैं. प्लस इसमें हम माइंडफुल ईटिंग, माइंडफुल ब्रीथिंग या माइंडफुल वॉक भी करते हैं, जहाँ पे आप अपने 5 सेंसेस को प्रेजेंट मोमेंट का कनेक्ट करते हो. सो इन टेक्निक्स के जरिए बेसिकली आप अपने आप के स्ट्रेस को मैनेज कर सकते हो, अपनी एंजाइटी को मैनेज कर सकते हो, एंड यू विल मोर अवेयर अबाउट द सिचुएशन कि आप उसको डील कैसे कर सकते हो, बजाय उसमें जजमेंटल होने के, इमोशनली डिस्टर्ब होने के.
जी, थैंक यू सो मच. आई थिंक जो एक बहुत बड़ा इम्पोर्टेंट पॉइंट था कि जब आप एक्सेप्ट करोगे तभी आपको मालूम पड़ेगा कि सिचुएशन को कैसे डील किया जा सकता है, because and that's where I think mindfulness plays the biggest role. So thank you so much for that, ma'am. Drishti ma'am, I'd like to go back to you for a second, and if you could just please elaborate on the 5 4 3 2 1 method that you had stated earlier, because I think that's one of the most popular grounding techniques.
Yes, can you hear me?
Yes.
Right. So mindfulness and grounding, जैसे हम सब बात कर रहे हैं, goes hand in hand. The most common technique is 5 4 3 2 1. Starting with our senses, we have 5 senses, right? We have the ability to see, we have the ability to hear, taste, smell, and touch, right? So ये जो activity है, ये वही करती है. We start by noticing 5 things around us in our environment currently that you can see. So what are the 5 things right now? And I think this is something everybody can do right now, and maybe see if we can ground ourselves or be more mindful. So what are the 5 things in your environment that you can see right now? Okay. What are the 4 things that you can touch around you? Okay. Let's now think of the 3 things around you that you can probably hear, and you can include my voice. Okay. 2 things that you can smell. Right. And the last one thing is that one thing you can taste. At this point in time, I'm assuming कि कोई अभी lunch नहीं कर रहा है. So that will be very difficult. Sometimes it's very difficult to smell a lot of things. At home, it's easy कभी ना कभी किसी की मम्मी खाना बना रही है या कुछ हो रहा है. So what we also do with the clients sometimes is we give them tangible cues. If it's easy to see 5 things around you and touch 4 things around you, but sometimes it can be difficult to hear 3 things around you, right? So sometimes you have to micro focus and then see कि क्या क्या हो रहा है. Some child is crying outside, traffic है. जैसा स्वाति ने mention किया, most times big cities में you can definitely hear traffic jam for sure, right? With respect to smell now, you can smell your own sweat. You can smell somebody else's perfume. You can smell food being cooked somewhere, right? You can smell the air freshener. In school, you can smell multiple sweats, right? So I'm just saying that there are multiple things. You just have to be more aware about it. That is the whole point of being mindful and grounding yourself. And with respect to taste, something that we recommend to clients is maybe having a little bit of chewing gum or mints, pani, just having something for your taste buds as well. We don't have to do all 5, 4, 3, 2, 1 all the time, but just getting started with that practice helps you ground you at that moment already. अगर at that point in time आपको लग रहा है कि नहीं कर पा रहे 5, 4, 3, 2, 1, maybe you can also do a simple activity of choosing your favorite color and finding 5 things around you of that same color. At that point in time, that can also help you ground yourself. So 5 blue things that I can see at this point in time, or 4 pink things that I can see at that point in time. I think somebody also mentioned in the chat to do with breathing. So maybe you can also focus on your breathing. I wouldn't recommend it because that can also have counter effective issues if your breathing is too fast paced. But I think grounding ke liye, something to do with your senses at that moment would be a good idea.
Absolutely. Thank you so much for that, ma'am. And thank you for taking us through the exercise. I think everyone in the chat is also saying that it helped them. So thank you so much for that. And it's definitely an activity that I feel can be employed every now and then. So, whenever someone needs to ground themselves. So thank you so much for that. Now, because we have quite a few audience questions, I'd like to move on to taking the direct questions from the audience. I'd like to start with Nimi Abraham. If you could please unmute and ask your question.
My question is, I have seen some children. What happens is that their one hand shivers. Suddenly, the one hand, or either is left hand or right hand, it shivers. I have come across this type of children a few times. Is it the symptom of? Is this one of the symptoms? And what could be the immediate measure that the school can take? Shivering of hands.
Thank you so much for your question.
Basically in class 10. Yeah, thank you.
All right. Would any of our panelists like to take this up? Ms. Swati, if we could hear from you.
Sure. So, ma'am, shivering of hands can happen due to different reasons. Sometimes, there's a medical condition जिसकी वजह से थोड़ी सी shivering होती है. So it would be a good idea to just find out, because before labeling or before actually thinking that somebody has a dissociative disorder, it's good to actually have a medical diagnosis so that any medical condition can be ruled out. हम ऐसा भी नहीं कर सकते कि जनरली कह दें कि dissociation है, and some medical diagnosis might get missed and it may actually worsen the condition. So the first step would be to actually request for a thorough medical examination. Now let us say कि कोई medical concern नहीं है, then it would be a good idea to find out कि क्या specific situation है जब बच्चे का hand shiver करता है या हमेशा shiver करता है. Does it happen only in school or does it happen at home as well? If only in school, does it happen in particular situations in front of particular teachers, or does it happen all the time? once we get to know about these things, so I'm sure आप लोग किसी teachers हैं, you all also have a lot of experience, तो कुछ idea लगने लगेगा कि dissociation है या नहीं है. Let's say it happens in certain situations and not others. इसका मतलब and similar situations, you know, इसका मतलब हो सकता है dissociation हो. So it could be a good idea to maybe refer the child to a clinical psychologist. अपने end से you can try to find out as teachers. एक तो again like not to give extra attention, but you know, focusing on communication is important. Especially if you share a good rapport with the student, or if you know one of the teachers shares a good rapport with the student, they could probably have a talk with the child to understand ऐसा क्यों हो रहा है. And then you know, अगर आप लोगों को reason पता चल जाता है, sometimes dealing with the reason with the stressful situation might help. Otherwise, you know, just try to not put too much focus on the shivering. अगर आप लोग बार बार कहेंगे why is your hand shivering, तो हो सकता है बच्चे को याद आ जाए, या हो सकता है वो चीज reinforce हो जाए. So not mentioning too much about it will help. These are some of the general things you can do. And of course, ma'am, after that, it is situation specific. But you can start with this.
Absolutely. Thank you so much, Swati ma'am, for giving that comprehensive example.
you.
And it definitely points to another thing that I think we sort of missed out on talking about, is that we can't directly correlate a certain behavior to be dissociation. So thank you so much for, you know, kind of telling us that we have to go through a proper medical examination first to see exactly what it is, because we can't draw that correlation immediately. So thank you so much for that, ma'am. The next, thank you so much. The next live question I'd like to take is from Ume Salma. If you could please unmute and ask your question.
Yes, ma'am. I would like to know about, can disorder go away without treatment?
Thank you so much for your question. Ms. Mohini, if we could hear from you about this.
Can you please repeat the question? Hello. Hello.
Yeah, can the disorder go without treatment?
Disorder go without the treatment.
Yes.
Sometimes disorder go without the treatment, but if there is a lot of stress and it's happen frequently, so definitely there is a need of treatment. It is not happen ki dissociation disorder and it is go without the treatment. If the patient or person जिस reinforcement या जिस attention gain के लिए unconsciously उसका dissociation हो रहा है, अगर वो fulfill हो रहा है तो definitely it can go, but अगर वो long term चल रहा है तो definitely there is a need proper treatment, otherwise it will convert in a depression or anxiety or maybe dissociative personality disorder. Yeah.
Thank you so much, Mohini ma'am. I'd also like to go one step ahead and ask, what is the right treatment to seek in this journey of, if someone is diagnosed with a dissociative disorder or it's suspected, what is the right treatment to seek?
Yeah, definitely. If there is a suspect or there is any doubt for dissociation, so first of all, जैसा स्वाति ने बताया कि first of all तो we need to examine medical condition कि कोई medical issues तो है नहीं, किसी medical condition की वजह से तो उनको कोई shivering या कोई बेहोशी या फिर कोई fits का problem तो नहीं हो रहा है. If that is not, then definitely the second जो step होता है वो होता है clinical psychologist, जो प्रॉपरली इस चीज को अंडरस्टैंड करते हैं, रीजन या स्ट्रेसर फाइंड आउट करते हैं कि क्या स्ट्रेसर है जिसकी वजह से दैट पर्सन या दैट पर्सन जो है वो डिसोशिएट हो रहा है, इन विच कंडीशन इट इज मोर हैपनिंग. सो फिर देन वी विल स्टार्ट विद द सीबीटी और माइंडफुलनेस टेक्निक, जहां पे प्रॉपर हम पर्सन के साथ डील करते हैं कि बेसिकली बाय द थेरेपी वी अवेयर देम कि या इंसाइट करवाते हैं कि भाई वो चीजें क्यों हो रही हैं एंड हाउ टू डील, उनको कैसे स्ट्रेसफुल सिचुएशन में अपने आप को डिसोशिएट होने से बचाना है. समटाइम्स साइकेट्रिस्ट जो होते हैं वो स्ट्रेस मेडिसिन भी प्रिस्क्राइब करते हैं फॉर द इनिशियल लेवल, सो दैट कि वो कुछ समय के लिए होल्ड ऑन हो सके, बट जो इसका प्रॉपर ट्रीटमेंट है दैट इज ओनली द थेरेपी.
Got it, ma'am. Thank you so much. I also want to just throw one more question at the panel, because I was just thinking about this from the perspective of someone who probably has a dissociative disorder. Obviously, we've talked about mindfulness, and that self-awareness is key. So how does someone know that they themselves might need help? What are signs that we should watch out in, like, for ourselves? What are things that we should look for in ourselves? Or, at what stage do we say, okay, I might need help, or I may be going through something? So if we could hear from Ms. Drishti about that.
Right. So I personally think, and maybe this is a very reductionist perspective, but I think there is no way you will benefit from therapy or help if you've been sent there. I think you only benefit from therapy or counseling or any form of help only when you go there for yourself and you know why you're going there, right? That being said, when do you need help would probably be when you feel like something is not normal, whatever your definition of normal is. I think pandemic ने हमें सिखा दिया है कि हमारी definition of normal has to change. But whatever your definition of normal is, if you feel like I'm not able to cope up with the current circumstances, with the environment, and I feel like there needs to be something done differently, or something is not going right, there is too much stress, or धीरे धीरे करके stress इतना बढ़ गया that it has snowballed into something very big, or it's been too long that I've been brushing things under the carpet, so I think therapy is most effective when you are ready for it. And I also think that help can be both restorative and preventive. इसका मतलब ये है that you don't have to necessarily go seek help only when कुछ गड़बड़ हो चुकी है, right? It can also be जब तुम्हें लग रहा है, signs दिख रहे हैं, and there is a whole difference between signs are things that we can notice and symptoms are things that a clinical psychologist or a counseling psychologist or a psychiatrist can notice. So धीरे धीरे if you can see even basic changes in your biological rhythm, so you feel like नींद कम आ रही है, नींद ज्यादा आ रही है, या खाना खाने का ज्यादा मन नहीं है, या मूड ज्यादा खराब लग रहा है, I think these are times where, and consistently, right, over time अगर ऐसा हो रहा है, I think that would be a good time for you to notice and say maybe I need help, maybe I need to talk to somebody. And I think India में ये एक system बना हुआ है कि somewhere we figure out the problem is within ourselves, then we talk to our friends about it, or if you're closer to the family, we'll talk to the family. They'll try to give us help, they will try to support us, right? So I think, and then maybe we go to a doctor, family doctor, and then we go to a specialist eventually. So that gap between, am I able to deal with this? Yes. Okay. If I'm not able to deal with it, who is my first person of contact in my first circle, in my support circle? Can I go to them? Are they able to help me out? Great. If they're not, that would be a good time to go out and seek help. And I think that's across disorders and not just dissociation. I think it's a little more difficult to notice dissociation, but when you realize that you're zoning out more, or you're not able to connect with people, you're feeling a little detached, you're more in your reality and in your head a lot, I think you can kind of notice that. Even your peers can notice that a lot of times. So that would be one time to, figure out what the problem is and maybe seek help.
Absolutely. Thank you so much, ma'am. And I think that perfectly sets the stage for the next live question I want to take up, which is from Priya Kapoor. If you could please unmute and ask your question.
Good evening, ma'am. Ma'am, yes. Ma'am, if I am noticing a student who is not able to concentrate in class, could it be a dissociative disorder? And I want to know, other than meditation, if on a simpler basis, being a teacher, if I want to improve his concentration, other than meditation, what methods can I use? Thank you.
Thank you so much for your question. Ms. Swati, if we could hear from you on this.
Sure. Thank you for the question, ma'am. Ma'am, just if we say the students are not able to concentrate, we cannot really say कि वो dissociation की वजह से ही हो रहा है or that it is a dissociative disorder, because you know it's a general tendency of students वो थोड़े शरारती होते हैं, पढ़ाई थोड़ी बोरिंग लगती है a lot of times. तो कई बार ध्यान इधर उधर भटक रहा है, and you know I think a lot of your students might be teenagers or pre-teens, तो उनका ध्यान वैसे भी थोड़ा बहुत दूसरी चीजों में थोड़ा ज्यादा हो जाता है. तो मोस्ट प्रोबेबली ऑन अ जनरल लेवल इफ वी से इट इज नॉट डिसोसिएटिव डिसऑर्डर. कभी कभार अगर डे ड्रीमिंग वगैरह हो तो डिसोसिएशन हो सकता है, बट नॉट अ डिसोसिएटिव डिसऑर्डर पर से. It's also important to understand the difference between dissociation and dissociative disorder. Dissociation किसी के भी साथ हो सकता है. मैं एक दूसरा एग्जाम्पल लेती हूँ जिससे कि समझना थोड़ा इजियर हो जाए. जैसे मान लीजिए आपकी किसी से लड़ाई हो गई तो आपका मूड ऑफ हो गया, यू नो. So that is something that can happen with any of us, and it is something very normal ना कि किसी से लड़ाई हो जाए तो मूड ऑफ हो जाएगा. But it remains like that for a while, उसके बाद ठीक हो जाता है. So that is actually something normal. Usually, again, I don't like using the terms normal and abnormal, but this is a word that mostly people relate with. So that is nothing to worry about. That is something usual. But if we talk about somebody who has depression, let's say, तो उनके केस में क्या होगा? अगर मान लीजिए किसी से लड़ाई हो गई तो मूड ऑफ हो जाएगा, अपसेट हो जाएंगे, and that will persist for a long time. It will also happen कि हो सकता है कुछ और हो गया, या जो चीज दूसरों को insignificant लगे वो इन्हें हो गई, but that will hold a lot of importance in their life and their mood also. So that is the difference between normal way में mood खराब होना versus depression. Now coming back to dissociation and dissociative disorder, it is the same. Dissociation किसी के भी साथ हो सकता है, कभी भी हो सकता है, but usually छोटे समय के लिए होता है. As such life पर कोई impact नहीं पड़ता. Dissociative disorder is something more serious and something that needs attention, you know, psychological attention. So that is when you know it becomes a general way of coping with situations. A lot of time is actually wasted. Yeah, a lot of time the person has dissociative features or some problem जो उनके daily life को impact कर रहा है. आम शब्दों में this is what it is. So lack of concentration may not actually be a dissociative disorder, and to a great extent dissociation भी probably नहीं होगा. Now ma'am, you also asked कि बच्चों का concentration कैसे improve कर सकते हैं हम. तो मैम concentration in general अगर आप as a teacher बात करो, so if we call for more role plays in the class, if we call for more interaction in the class, that is something which will probably keep their attention drawn, at least lecture type teaching से ज़्यादा. And मैम इसमें भी you know एक general अगर हम देखें तो not 100% of the students might have their attention drawn towards you, and this is just something that happens with all of us in school and college across fields. तो concentration बच्चों का increase करने के लिए आप different modality use करिए. कभी कभी आप role plays करवाइए या different groups को कुछ project दीजिए, or you know you could probably start with something that is more instantaneous. आज I'm going to introduce a concept and then I'm going to call a few students who will be given 10 minutes and they have to explain the class about it, or you know something like that, which is a little different maybe. So that will probably keep the class more engaged. Did I answer your question, ma'am?
Yes, ma'am. Thank you so much, ma'am.
Thank you.
Thank you so much, Ms. Swati. Also, thank you for highlighting that difference that I feel was very important between dissociation and dissociative disorders. I think there were also quite a few questions in the chat of, you know, how to figure out what is normal, what is not, you know, what level of dissociation is normal. So thank you for clarifying that up as well. The next live question I'd like to take is from Raj. If you could please unmute and ask your question.
Hi, I actually have two questions. Question one is, does modern nuclear living and overall breakdown of community ties lead to increased stress and probably in children lead to disassociation? The second question is, does excessive time spent on social media create a sense of alternate reality among children, and can this trigger feelings of dissociation? Thank you.
Thank you so much for your question. I'd like to take the first question about nuclear families first. Ms. Mohini, if we could hear your views on that.
Thank you for this question. We cannot say truly कि nuclear families ज़्यादा हो रहे हैं इस वजह से stressor and that बच्चों में dissociation increase हो रहा है. Joint family में भी ये चीजें होती थी, but I think वो diagnose नहीं हो पाती थी. But there is another reason also कि joint family and nuclear family में differences ये है कि joint family में sometimes you ओपन अप और यू शेयर द थिंग्स. आप वहां पे बैठते हो, साथ में खाना खाते हो, तो चीजें काफी आप शेयर कर पाते हो. न्यूक्लियर फैमिली में क्या हो रहा है कि वहां पे बहुत लिमिटेड फैमिली हो रहा है, लिमिटेड फैमिली मेंबर्स हो रहे हैं, एक दूसरे के पास उतना शेयरिंग करने के लिए टाइम नहीं है, तो वहां पे स्ट्रेसर ज्यादा इंक्रीज हो रहा है, इंट्रोवर्ट हो रहा है या शेयरिंग नहीं कर रहे हैं, तो वो चीजें इंक्रीज हो रही है. दैट्स व्हाई वहां पे क्या हो रहा है कि स्ट्रेस बढ़ रहा है, एंजाइटी इंक्रीज हो रही है, और जो कि कहीं ना कहीं डिसोशिएट डेवलप कर रही है. So there is a little bit difference, but we cannot say properly कि yes, nuclear family increase हो रही है, तो dissociation भी increase हो रहा है, या dissociation nuclear family में ज्यादा हो रहा है. पहले भी होता था, joint family में भी होता था, because I am working with dissociated people, तो joint family से भी काफी youngsters आते हैं जो कि dissociate होते हैं. So there is I think depend on कि families के बीच में sharing क्या है, कितना है, open up कितना communication वहां पे होता है. That is more important. Yeah.
Thank you so much, ma'am. I think it ties back to हमने पहले भी discuss किया था कि अगर किसी के पास outlet नहीं है, then dissociation increases. So thank you so much for that. The second question, I would like to open up to anyone on the panel who would like to take it on social media and creating that sense of alternate reality. Absolutely, ma'am.
Right. So this has been something that I'm very keen on exploring, which is internet addiction or social media use, overuse, whatever it is. But I think when we're playing a game, right, if we are online gaming or if we are in a world of Instagram or TikTok or Facebook, whatever it is, but Snapchat, we are creating an alternative reality. Right, but somewhere that is also a normal with our friends. If we're not existing in that reality as a form of avoidance or escapism, we are existing in that reality with our friends, with our social network groups, right? So if I am on Snapchat, I am still sending, or I still have a snap streak with my friends. Or if I'm on Instagram, I'm still sending memes to my friends. So is it a form of dissociation? Partly, if I'm only scrolling, or if I'm only if I'm creating a reality where it's just me. If it's a strategy to help me cope, yes, it's a form of dissociation. But if it is a form of, and dissociation meaning both depersonalization and derealization, whereas I'm not in touch with the real reality and I'm in a virtual reality, I'm able to also on social media present myself in a depersonalized way, right? So if I look or if I feel a certain way, social media I can create a completely new image or avatar of myself, right? I can be a completely new person. But if I'm connecting with the same friends that I have back in school or college, if I'm connecting with them on social media, is it really dissociation? I perhaps might only be dissociating from my parents and my family, but not as much as from my peers at this point in time. So that's how I see social media. And it's also about your relationship with social media. Are you only a consumer? are you only a passive recipient or are you actively involved? Because जितना आज हमने dissociation की conversation में सीखा है, somewhere while mindfulness helps you control the situation, dissociation is also a form of controlling your reality, right? By building a new reality. So क्या social media पे जाके you're constructing a new reality altogether? Yes. So yes, you're dissociating, but you're also keeping in touch with the real reality. That's my 2 cents. And if anybody has, does that make sense? On the question Raj asked, right?
Thank you so much.
Yeah, ma'am, it does help answer the question, but I've actually seen cases where some kids tend to be abusive, rude online. So those were the specific cases I was referring to.
When you say that they are abusive or rude online, are they not like that in person?
No. Only on social media, not in reality. But when they come on social media, they apparently take another avatar of being a very abusive person or a mean person or those kind of personality traits.
Right. So they are channelizing some parts of their personality in a virtual setup. Because obviously, at the end of the day, we want to be liked by the people in our real life. And it's easier to be anonymous on the internet and be rude or aggressive or violent, right?
Absolutely, ma'am. Thank you for that answer, and also for that very that distinction that I don't think a lot of us would have noticed, that talking to the same people online versus being in isolation online can kind of bring out 2 different traits in a person. So thank you so much for that. The last question I would like to take from the audience is from Kirti Vora. If you could please unmute and ask your question.
Yeah, good evening, everyone. So my question is, how can we help an early young adolescent, per se at the age of 10 or 12, notice dissociation disorder and help himself or herself? Or do we really need a caretaker to get him to the right intervention? That's my question to you.
Thank you so much for your question. Ms. Swati, we could hear your opinion on this.
Thank you for the question. Ma'am, I personally feel that when children are 10 or 12 years old, they are still kids, and they may not really, like, it would not be a very good idea to let them know कि ये तुम्हारे signs of dissociation है, या this is what is happening and this is what you should do. Because I feel like most children are too young to understand it and get a feel of what to do, how to do, and to take it the right way. Sometimes it may actually do more harm than good. So for a 10 or 12-year-old child, it is a better idea to take them to a therapist. Because, of course, everybody has to be dealt with in a sensitive manner, but more so when you are dealing with a child. कई बार आप सुनते होंगे ना कि टीचर ने कुछ कह दिया when I was 5 years old and that still has an impact on my mind, or when I was 10 years old. So we don't really want to put the child through something like this. It would be best to refer them to a trained professional, number one. And number two, not really talk about these things with the child directly. Uske baad, based on the child's cognitive abilities and emotional abilities and the entire situation, the therapist will tell you how to deal with the child. And it would be better to actually let the child and parents, let the teachers know whatever has been communicated. That would be the best approach. That's what I feel.
Absolutely. Thank you so much.
Thank you so much. Well taken.
Thank you.
Thank you, ma'am, for your question. And I think that's where we would end with the audience questions. Just before we wrap up the session, I would like to ask our panelists for just some closing remarks on the topic and some key takeaways that you would probably want the audience to take away from this session. So if we could start with Ms. Swati and then move around the panel and hear from everyone.
Sure. Thank you so much for inviting all of us. It was a really fun session for all the panelists, I'm sure. It was for me. And I hope it was informative and not boring for those listening, because that is one very major factor. So just some key takeaways. Firstly, as individuals and as people who have interactions with somebody or the other every day, I feel like, at least all of us can do our part in providing a safe space to those around us, not jump to conclusions, not be judgmental. And whenever you feel कि somebody might be going through something या कुछ गड़बड़ लग रहा है, just try to have a conversation with them in a non-judgmental manner, अपने side से, right? Because कहीं ना कहीं अगर हम देखें dissociation वहां से भी तो आता है ना, because we cannot communicate what we are feeling. A lot of times we can't communicate कि आप लोग मुझे ignore कर रहे हैं, मुझे ये चीज अच्छी नहीं लगती. Yeah, I would like it better if I was also acknowledged. So these are the small things that all of us go through at different points in time. So all of us individually can try and create a safe space for those around us. So it will have a direct or an indirect impact on everybody. And it will reduce chances of dissociation. Or इसके अलावा, like we were talking, not to give them. Not only people having some dissociative disorder, but in general also. किसी को कोई physical health condition भी है, so of course show your concern, be there for the person, but please do not give too much attention. Do not excuse them from everything possible, because it will help them stay in that patient role for longer. So you can provide them some comfort, but also give them that space to be responsible, and it will make a better society for all of us. Thank you so much.
Thank you so much, Ms. Swati, for those wonderful closing statements. Thank you. If we can move on to Ms. Drishti.
Right. So firstly, thank you so much for having us. It was so much learning from the audience, and it was really nice how attentive everybody was. And thank you so much, Swati and Mohini. I think it's nice to be in this space, right, where it's like you're revising everything that you've learned. So thank you so much for that opportunity as well. But a couple of takeaways or just parting words in that sense is, it's nice to know about dissociative disorders, but it is very fine. There's a very, very fine line between what is normal behavior and what is not, or what do we define as normal, or what do we see as normal. So I think it's important for us to be mindful of how we treat that binary between normal and not normal, right? Just like dissociation is break in that continuum, maybe we also need to see normalcy as a continuum. Something that might be not normal for you might be normal for a child who's unable to concentrate or is using dissociation as a stress mechanism. And where I think the only line is to know when to seek for help and where is the right place to get help, right? So I guess something that we can all be, or a take back from the session would be to be more mindful individuals, at the same time also mindful of how we are judging people, and are we judgmental, or are we able to create that space of acceptance or safety for children and adolescents around us. So that's how I understand it. Thank you so much for this.
Thank you so much, ma'am. Thank you for that. And also, I think that's a very important takeaway, being mindful of ourselves and of everyone else. So thank you so much for that. Finally, if we can hear from Ms. Mohini.
Yeah. First of all, thank you so much, Sharp NGO, which is keep this topic, which is very needful to discuss and aware about it. कि dissociation exactly क्या होता है. And yeah, thank you other panelists जिन्होंने बहुत insightful information दिया. And yeah, so from this session, जो I would like to say keywords is like कि डिसोसिएशन अगर हम बात करें इन चिल्ड्रंस, विच इज आई थिंक यूथ इज चिल्ड्रन इज जो कि आगे जाके एडल्ट बनता है, अगर हम उस पर अच्छे से काम कर लेते हैं तो आई थिंक मेजर एरिया जो है मेंटल हेल्थ का हम कवर कर सकते हैं, सो या एंड द सेकेंड थिंग की जैसे स्वाति ने भी बताया कि प्रॉब्लम स्टार्ट वहीं से होती है जब हम सबसे पहले शेयर ही अपनी सारी चीजें अपने फ्रेंड सर्कल या अपने पेरेंट्स या अपने क्लोज वन के साथ करते हैं, तो वहां पे अगर वो जो पर्सन है अगर वो नॉन जजमेंटल होके या जस्ट एक शेयरिंग ही कर ले, क्योंकि व्हेन मेरे पास पेशेंट आते हैं तो उनका एक सिंपल सेंटेंस यही होता है कि कोई है ही नहीं शेयर करने के लिए, कोई है ही नहीं सुनने के लिए। और सेकंड पॉइंट ये भी आता है कि किसी का शेयर करे तो कहीं वो उसका मिसयूज ना कर ले, कहीं वो जज करना स्टार्ट ना कर दे, कहीं वो क्रिटिसाइज करना स्टार्ट ना कर दे। तो बच्चे आते हैं, वो बोलते हैं कि मम्मी को मैंने बताया कि स्ट्रेस हो रहा है, तो मम्मी बोलते हैं क्या स्ट्रेस, ये किस तरह का स्ट्रेस होता है। तो दैट इज नॉट, इट इज नॉट लाइक दैट, ऐसा नहीं है। तो जस्ट जो भी यंगस्टर्स आपको बोल रहे हैं आप उनको सुने, उनके लेवल पे वो प्रॉब्लमेटिक हो सकता है, स्ट्रेसफुल हो सकता है, which can be increased in a dissociation form, can be increased in dissociative disorder form. So this is my point, जो कि I think ये हम सबको कैरी करना चाहिए, इन टीचर्स को भी, पेरेंट्स को भी, एंड ऑब्वियसली अगर यंगस्टर्स भी हैं यहाँ पे तो उनको भी। Yeah.
Thank you so much, ma'am.
Thank you so much.
I think एक जो सबसे important point आया है सबसे is that we have to create a non-judgmental space ताकि सब लोग share कर सके और the problem can be mitigated at its root itself. So thank you so much. I'd like to thank all of you once again for this very insightful conversation. I think from where we started, just defining what dissociative disorders are, to discussing the types, the manifestation, kind of the red flags, from the stakeholders' perspective, and then from the perspective of the person themselves. And then I think we also briefly touched upon treatments and the second dimension of today's topic, which was mindfulness, its techniques to deal with dissociative disorders as well. And doing that little short mindfulness practice, I think it was overall a very, very interesting session, and joined by a very invested audience who brought up some very important points from the social media to social structures and classroom interventions. So I think this was a great session overall. I'd like to thank all of you again for your time and for your beautiful insights on this topic. And thank you to everyone in the audience for joining us on this very important conversation. Thank you, everyone. Have a good evening. We request all of you to please fill out the feedback form on your screens. If any of your questions were unanswered, please post it using #webinar_by_sharp on social media platforms, and we will try to answer them as soon as possible. Subscribe for latest updates of our upcoming webinars on our website, www.schoolindia.org. Sharp NGO conducts free mental health awareness sessions for school students pan India. To register your school, please visit our website, www.schoolindia.org.